Welcome back. We're now looking at testing your fertility. Most important of all, there's no specific test of fertility for egg, sperm or embryo. Having regular periods or having eggs present is no guarantee of having a child. Numerous other so-called fertility tests are really indirect tests which exclude other causes of fertility. Female age and plus indirect tests provide the best predictor of outcome. Tests of ovarian reserve we've mentioned already, and this is an antral follicle count performed with ultrasound or an anti-Mullerian hormone, a blood test otherwise known as AMH. Fertility specialists will also do a number of other tests of ovulation. These are hormonal tests done by means of blood testing and include a basal level of follicle stimulating hormone or FSH and tests of the adrenal glands, thyroid gland and prolactin. Tests of the reproductive pathway, that is the uterus and tubes, will include a hycosi, which is a pelvic ultrasound with the introduction of fluid to demonstrate the interior of the uterine cavity and whether your tubes are open, or a hysterosalpingogram, a similar test to the hycosi, but this time it involves the use of X-rays. I would now like to deal with saving your fertility. The options include not deferring having a baby for any reason whatsoever, that's being social, lifestyle or business reasons, to maintain a healthy lifestyle, and where no other options exist, seriously consider egg freezing. Egg freezing, or it is otherwise known as oocyte cryopreservation, is a treatment that requires IVF. It's best undertaken before the age of 30, and we get very poor results after the age of 38 to 40. Older patients will need more eggs to freeze, and unfortunately, older patients get less eggs per IVF cycle than younger patients, and therefore require a lot more IVF cycles, which are both stressful, invasive, and costly. The biggest question when it comes to egg freezing or oocyte cryopreservation is how many mature eggs need to be frozen in order to guarantee a live birth? The answer is not known. It is very much age dependent. The literature would suggest a minimum of 10 to 20 mature eggs need to be frozen for a reasonable chance of a live birth in women less than 35 years of age. Once we exceed this age, there's no specific number, and it eventually ends up in having as many attempts as IVF as one can manage. And finally, the real question is, how do I start? I recommend you go to www.sydneyfertility.com.au. You can either make an online appointment to see me, or you can arrange for a free fertility evaluation with one of my fertility care professionals, or you can undertake an online fertility self-evaluation. Whatever you do, I recommend you start so you can plan your future fertility. Thank you for your attention.